Good morning, 6:44. Time for your health check. Sonia Azad has something parents need to consider no matter whether their children are attending school in person or online.
Parents, I want to make sure your children are up to date on their back-to-school vaccinations. Here's a look at the requirements backed by both the CDC and the American Academy of Pediatrics. Whether your kids are doing school in person or online, they're still required to be up to date on their immunizations in order to enroll.
So if you have a kindergartner, they have to have their 4-year-old vaccines before they will be permitted to take classes in school, the same as if they were attending classes in person.
The big ages to remember for school vaccinations are 4, 11, and 16 years old. Let's start with age 4. Some recommended immunizations include tetanus, polio, flu, and MMR. That's measles, mumps, and rubella.
If your child is up to date at 4 and they've had their 4-year-old vaccines, then they will be admitted to school.
At 11 years old, there's more.
So at 11-year-old, they get an additional set of boosters and 1 new meningitis vaccine that's required before they go to school.
This is also when parents and pediatricians consider the first in a series of 2 HPV vaccinations.
Vaccination can prevent up to 90% of any HPV-related cancers.
According to the American Cancer Society, before the COVID outbreak, more parents were getting their tweens and teens vaccinated against the human papillomavirus. Then in April, a 70% drop in those cancer prevention immunizations. Now that number hovers around 50%. Doctors trying to get those kids, both boys and girls, back into their offices.
I talked to a mom yesterday who goes, "Oh, I forgot to get her the second one within 6 months. So now do I have to get both of them again?"
That's a great question. No. As long as the child is under 15 years old, they can still complete the 2-dose series.
By age 16, there's one more recommended dose.
They get another meningitis vaccine at that time.
Dr. Dawn Johnson from Children's Health in Dallas saying the overall point of these immunizations is especially important now to mitigate outbreaks of vaccine-preventable illnesses.
In the setting of coronavirus, it's very important that we try not to overburden our healthcare system. So in the fall, we want to prevent seeing an outbreak of measles in the setting of flu and coronavirus. And that's why it's one reason why it's important to get vaccines on the regular schedule.
For college-aged young adults, there is a separate type of vaccine for meningitis. By the way, with that HPV vaccine, you can get a catch-up immunization up to age 26. With your health check, I'm Sonia Azad.